Hi, my name is Liza Shapiro, and I am the district PTA chairperson of special ed, and that's Lucille Rossi. She is our special ed Greeley chairperson. Let's see, we've got Katie and Jennifer. They're at West Orchard. They're our special ed chair people, and I think that's it for our special ed committee. In addition, Liz Wright and Kristie Evers and Stephanie Bellantoni are going to present.
Are you all on screen?
I think.
Take a minute.
You're good.
Take a few steps over.
Might be enough.
Yeah, me neither. Liz, one more step over.
Oh, okay.
There's Liz. Okay.
Stephanie is from the WIHD. She is from the Parent Center.
I'll tell them all about
Okay.
it. Yeah.
And then they're from Chappaqua Central School District. And thank you guys for coming. Thank you. I think it's this big one.
So, hi everybody. I was just saying before we started, I was talking to Kristie and Liz about how much I like to come to Chappaqua, probably because I always see familiar faces. I think it's great that you guys are a cohesive group and you come together, and maybe the topic isn't even exactly something you're looking for, but you support each other, and I think that's really great. I think that's important for parents to become more engaged and feel comfortable that they have a population that's behind them, that's kind of going through it with them. So anyway, yay Chappaqua, that's fine. Good for Chappaqua. So my name is Stephanie, and I do work at the Westchester Institute for Human Development with Lucille, who I'm very happy to see today. And what the Institute does is they are one of 67 university centers for excellence in developmental disabilities. So the entire building houses a number of different departments, many of them medical and clinical, to support individuals with disabilities and their families across the lifespan. So everything from early intervention up until adult life. And the Special Education Parent Center is housed in this community support network. So we're not providing medical care. We are actually providing information and support for parents to navigate special education and the disability world. So the Early Childhood Direction Center, those ladies do the same thing that we do at Parent Center, but for birth to 5. And then for kindergarten through age 21, myself and my colleagues Joyce, Lulu, and Naomi, my director, support families in understanding special education. What is it? What is the process? What is my role in it? What can I do? What things do we have a say in? What things do we not have a say in? What are the regulations? What is it all about? So that's what we do. And the Medicaid Service Coordination are for individuals who qualify for the Office of People with Developmental Disabilities. The Medicaid Service Coordination Unit will assist families in figuring out as they exit high school what supports and benefits are there out there in the adult life that apply to my kid. Am I eligible? Am I not eligible? Is he disabled enough? Is he too disabled? Like what are the channels of support, and how do I get there? So that's what those Medicaid Service Coordinators do for families. In addition, it really should be up here. In addition, we also have guardianship guidance. So another colleague of mine supports families in considering and exploring the opportunities of guardianship and supported decision making, which is kind of a new opportunity in that field. If you have a child for whom you are concerned that when they turn 18, as we all know, our children can then get a legal presumption of competency, make their own decisions, their own life, disability or not. So if we don't take steps to either pursue supported decision making or guardianship, we kind of run into trouble then. If God forbid somebody gets sick, or a medical decision has to be made, or a financial decision. So that's what Maryland will help you with. And then Parent to Parent of New York State, I really should have brought the flyers today. I'm very excited. We finally have a new body sitting in that seat. Parent to Parent of New York State is another state grant-funded entity, and they exist throughout the different regions in New York State. They support families in everything outside of education. So you are looking for a dentist who can manage a physically large child with behavioral issues, or you are looking for therapeutic horseback riding, or you are looking for another family who knows anything about Fragile X, or anything that you might be looking for that you just don't know where else to turn. You can call Parent to Parent of New York State for your region, and they will help channel you to the right support and the right help. So that's a little bit about WIHD. The Parent Center, which is where I sit, We provide direct service to families. Everything we do at the Parent Center is free. We do presentations like this one on a variety of different topics that we do have lists available, but we also will work with any school district or any SEPTA to create a topic, whatever it is that you feel would support your families and whatever they need. We have a digital newsletter, which if you are not already receiving it, if you put your email address on the sign-in sheet, I will gladly add you to our distribution list. So we pick a topic each month. We provide information about our upcoming events, and of course any timely announcements coming down from State Ed. What else did I miss? That's it. The only thing I wanted to add, I don't know if it's relevant to anybody in this room, but my colleague Lulu Bencosme also supports families in Spanish. So if you know of any friends or affiliates that you know of who would need this kind of support but are bilingual or need bilingual support, Lulu does all the same workshops that I do in Spanish, and a lot of our materials also are available in Spanish as well. So before we get into talking about our topic today, my name is Stephanie. I've been at the Parent Center for a couple of years. In my other life, I practiced law for a long time, but not in this field, so it was a complete game changer for me. I have 4 children in a neighboring district in Westchester County, and my oldest daughter is about to be 13, and she has developmental disability. So this all started for me 13 years ago, and I think with respect to, well, I'm a very different person than 13 years ago across the board, but I think certainly with respect to my efforts to support her and work with my school district, I am a very different member of that CSE than I was a long time ago. And we'll talk more about that later. Mm-hmm. But what we do at the Parent Center really is we try and help you parents understand what is going on, what is this all about, and what do I need to know to be an effective member of that committee. So today we're talking about educational support across the spectrum. I always hesitate to use the word spectrum in this field because we always think of autism when we think of spectrum, but I've come to believe that everything has a spectrum. I think Down syndrome has a spectrum. I think neurotypical people have a spectrum. I think there's just a spectrum of everything. So when we talk about supports for students in school, I think there's a spectrum. There's a little bit of support, there's a lot of support, and they all have different names, and there's a whole language we were talking about that you really kind of have to learn the vocabulary of the language or else you can't communicate. So we're going to talk today, and I changed the title of this workshop about a year ago. It used to be called Eligibility, and who the heck knew what that meant, right? So I changed it because often when I gave the presentation on special education eligibility, a lot of people would chime in with questions about RTI, right, which is response to intervention, or they would chime in about a 504, and what's that? And they would get very flustered when I would say, well, 504 is not really a special education initiative, because they didn't really know what that meant. So I said, I feel like I'm only giving a piece of the story here. So what I did is I changed the topic to general education supports and special education eligibility. So we're going to look at the whole gamut. So if you're sitting here today, you probably are a parent or a friend of a parent who's kind of got some wonderings about your child and how they're doing. Whether they have an IEP or a 504 already, or they don't have one at all, and they're just a typical student. So, sorry. Thank you. Yes. Yeah. So you may be developing concerns because your child is struggling with the schoolwork. It's just too difficult. He doesn't even know where to start. I don't have the time to sit with him and do all this homework. Maybe it's a social thing. Maybe your child's not making friends. Maybe you really feel like, well, that's great, he's getting all A's and B's, but something's just not right. Your child may seem to be unfocused at a level of frequency that really concerns you. He's just, bouncing off the walls and he's not paying attention to anything, and you can't really get any compliance at home, and you're wondering what's going on at school. Or your child may have significant behavioral issues, the management of which is really getting in the way of his success. But you've had him tested and he's all normal, right? I don't even know what that word means anymore in the last 2 years. I have absolutely no idea what that word means. I don't think it means anything, frankly. But something about your child's development or engagement in school is concerning you. Something is just not sitting right with you. Thanks. So what should you do? I start with speak to your child, and I don't care how old your child is. I don't care what means of communication you use to interact with your child, but my first go-to would be the child, and see what you can learn from that child about what they're experiencing in school. My daughter was probably in the 3rd grade before she was able to really tell me things that made me do a double take and think about, oh, something's going on, I need to talk to the teacher. But that turning point may be different for you. For you, it might be kindergarten, it might be 9th grade. But to at least have the conversation, to try, to see if there's any way you can get anything out of your child. Speak to the teacher. I can't tell you how many times, and I'm guilty of it myself, we go right to the top and start barking and complaining when there's a teacher sitting right in the classroom who's seeing everything that's going on and probably could have a meaningful conversation with you about what your child is struggling with, or what your child's succeeding at, or what suggestions he or she may have. You can speak to the principal. If the issues are more global and they're more involving things going on in the school, maybe it's at lunchtime or recess, right? Unstructured time is often very troublesome for our kids. Maybe it's something involving orchestra or chorus or band or something outside of the classroom. But the principal is always there for you to talk to as well, as a different type of a resource. Your pediatrician or any of the medical specialists that your child sees are another source of information. The point that I make here with this slide is really, you're going to start with your gut, but don't stop there. Explore and use the resources that are available to you. There's many, many people that work with your child and know your child through different lenses that may be able to provide helpful information. Speak to the principal about options. And this is really what we're talking about today, right? Building level supports, referral for special education, 504 plans, right? The heck is all of that mean? We're going to talk about that today, okay? So we should all have an understanding a little bit of what Child Find is. This is really all you need to know. Child Find is a federal regulation that puts the responsibility on school districts. There's no specifics about how, but the responsibility is on school districts to identify students who are at risk, to identify students who may need additional support, who may need more than what we give neurotypical kids, okay? It doesn't mean find them and give them an IEP 5 minutes later. It means find them and start exploring, right? So, and on the bottom there, that's just the US Code regulations for those of you who are law geeks like I am. That's where you'll find the Child Find language. So, general education supports is going to be the first step, right? You see a child that's struggling, general education supports, and this is something that varies district to district, okay? General education supports, and I'll just give you a couple of examples. Maybe something tragic happens in your district. Your social worker and your school psychologists are going to be available to everybody. They're not only going to help you if you have an IEP, right? Your subject area specialists. Maybe your district has a math specialist or a reading specialist. Those are available to students who need it. If a teacher is saying to herself, you know what, I'm really worried about this little girl, I want her to spend some time with the reading specialist, right? Those resources are in the district, okay? These are avenues to explore. You're not going to do it on your own, obviously, because you don't know how your district works and you don't know what those general education supports are. That's why you're going to talk to your teacher and you're going to talk to your principal and who your special ed department, whoever those go-to people are, depending on where you are in the process, okay? But you can't make those decisions yourself because you're not in a vacuum. You're part of a team, and the person sitting in the classroom with your child is really that front line who sees what's going on, okay? So let's go to the first slide. So can I just have a show of hands? How many people have heard of RTI, or response to intervention? And okay, about half. So response to intervention is a as of a few years ago, New York State mandated that all school districts must have some sort of an RTI program as part of the process for our younger kids, right? So it's usually K to 3, to figure out what's the obstacle, what's in the way. And you guys, please jump in anytime you want, okay? Because you guys are, well, you were on the front lines and you guys know all about how this stuff works. It's basically a recognition that our children of tender years, those K to 3, K to 4 years, there's a lot of reasons why they don't jump start into the reading and the academics. And it doesn't always mean they have a disability. It doesn't always mean they're going to be a special education student. There's a variety of different things. So response to intervention is basically a multi-tiered system of support, right? So no support is basically the general education instruction that the teachers are giving everybody in the classroom, right? And then there's another level of support for kids that need a little bit more one-to-one focus and a little bit more intensity of instruction. And then you have the smallest group that needs the most intense instruction. Maybe they're actually getting pulled out of the room. Maybe they're getting one-to-one instruction. The ins and outs of how the RTI system works in your district is for you to discuss with your teachers, with your administrators, to really get your head around how it works. And if your child is receiving RTI, you should probably be part of the conversation about how's it going. You know, is it working? What are we doing? Are we changing anything? This website down here, this nysrti.org, is basically a technical assistance center on RTI. There's a lot of reading material on there, if this is of interest to you, of how RTI is supposed to work, what it's supposed to look like in the districts.
Is AIS on the next slide? RTI again?
Oh, this is important, and then do you guys want to jump in a little bit?
Yeah.
So this is important to know. RTI, like I said, is something that school districts are going to pursue to support students so that we don't jump the gun and classify kids who don't really need to be classified. However, it does not mean a child can't be referred for a special education evaluation simultaneously. So your school district professionals may say to you, let's pursue RTI or let's pursue these general education supports. I really think it's going to make them move. But if you or anyone else close to that child says, I want a special education evaluation, it's absolutely appropriate, I want to say this, for your teachers and the people who are working to your child to express to you that they really don't feel that's appropriate at this time. It's not necessary, it's not reasonable. There's nothing wrong with it. At the end of the day, though, you want to send that letter and request the evaluation, you can do that. So that's really all this slide is communicating, is that it's not you have to do one first and then the other.
I have a question.
Mm-hmm.
If the school administration initiates the RTI, is there a certain amount of time that they have to allow to do that? You know, before they say, you know
Before
what?
a referral?
Yeah, to say, you know what, like, do they have to do it for a month? You know?
They may have a protocol, but it doesn't prevent you from referring.
Right, exactly. So, but the school administration, it's different, right? Okay.
Right.
Just
So here, oftentimes, and I don't want to say every time because all students are different. We recognize that through CSE, we recognize that through all of our committees here in the district. Oftentimes, we like to give a period of about 6 to 8 weeks to see how students are responding. And we like to see progress within that 6 to 8 weeks. And then if there's a concern, or even sometimes if there is progress, we may revise that plan one way or another. It doesn't necessarily mean that a referral to CSE is necessary immediately, but some revision may be required to that plan that was developed initially through RTI.
so if they find that they start the RTI and you know what,
Not responding to the
we
intervention,
think it
there
should
may
be,
be a
you
conversation.
were not, you have to wait a certain amount of time before.
There's no set time. There is some research that's available out there that discusses how, they use the term cycles, like how many cycles of an intervention. Usually that time is 6 to 8 weeks, typically. Part of that, and different districts call it different things, but I'll just call it your RTI team, just for the language purposes, that will review really how the student is progressing or not progressing based upon that intervention. Through conversation with the RTI team, that plan, like Liz was saying, may be tweaked. It may be a whole new different intervention. It may be smaller tweaks to that intervention that's being used, but that's all information to help the team, and you're part of the team in the conversation of next steps, if there are any that are required.
And if you move on to, let's see if there's eligibility here, is RTI still continued until the new diagnosis is?
Yes.
Okay.
Yes, and that information is always brought, if it's a parent referral or a district referral, that information from the RTI team of what interventions have been put into place prior to the referral, that's also a part of the conversation that takes place at the initial eligibility meeting.
And we talk about in-district academic intervention services.
Can you go to the
Yeah.
next slide?
Sorry.
Can I just ask one
No,
more
it's
question?
not
Oh,
John.
Jeff, that's okay. Go on. We talked about this. Yeah, you can go to the next one.
So academic intervention services, though, are available to your student regardless of whether you're eligible for special education or not.
Okay, so academic intervention services is, I'm sorry. Go ahead. Yes.
With respect to the RTI, if your child has an RTI, how often should you expect communication from the RTI team?
Again, I think that varies, and I think it's based on the plan. If it's something that you're experiencing with your child, I would suggest you reach out to the teacher and check in, and maybe ask those questions too.
But should you be part of the plan if it's redone? Will you know?
I think yes.
My suggestion would be, and again, because I mean, we're at
Yeah,
different
sure.
levels for us, because we're so heavily involved in the special education component. But that would be your first stop to ask those questions would be your classroom, your child's classroom teacher. I wouldn't expect progress, maybe information every week, but I would ask, how long do you think you're going to be, implementing this intervention? And when will I hear some feedback if it's working or not? And or what's the next step? I mean, I personally have done it for my own, not my daughter doesn't go here to Chappaqua, but it's very similar to what I did in my home district. Although I wasn't part of their sit-down team meeting, the teacher called me, it was a conversation, and then when I didn't hear it, I sent a quick email to see where we are in the process or if it's working or not working. Which as a parent helped me guide some of my decisions and moving forward, but also that fluid conversation and collaborative conversation with the classroom teacher. Because if there's anything that's being, some of the supports that can be provided in school, I also wanted to make sure if there was an intervention that you're doing in school, maybe I could have helped put that intervention in place when I'm doing helping with homework. So those are just,
Yeah, and I hesitate because Kristie talked about the minor tweaks that might take place or a major change. So, if there's a minor tweak that's taking place based on the intervention that they're providing, maybe they're working on a different work family. I don't know that that would be information they'd reach out to you for. But if they're making a major change, if there's areas of concern that aren't progressing, I would think that the answer would be yes. Okay? But definitely constant contact with your teacher is important.
So academic intervention services, just so that there's not confusion here, RTI is an academic intervention service, and I think the state's been pretty clear that if your RTI program is compliant with the regulations and what it's supposed to look like, you are satisfying academic intervention service requirements. So don't get confused about AIS, RTI. AIS is different because it's not always reading, okay? But essentially it's identifying kids who are at risk and giving them that support that they need. So as parents, I just think it's important to know this is out there, right? So that if you are a typically developing student, or you are someone who has been denied special education or denied a 504, ask about this. Truthfully, anytime there's an eligibility meeting for either, and that committee decides that eligibility is not the case there, the next conversation should be, well, how are we going to support this kid in general education? Okay, and that's where these systems come in. So just, again, I want you to know the vocabulary. I want you to know the systems that are out there.
Stephanie?
Yeah.
Just a question that comes up is, if a student is, I'll use the word denied special education services, but they want to trigger these, like academic intervention, how do they do that? Or maybe
So-
that's a Liz question, or Kristie question, like.
Probably, I think it's real. I think that these are things that's sort of ingrained in
In the school?
the school and how they're
It would be
functioning,
like
but
the
it doesn't
principal
mean
or
we
the
can't
teacher or
ask.
whatever?
Okay? And I just want to reiterate the communication piece. You don't want, it shouldn't be happening, but, if you missed a flyer in the backpack or you missed an email, your kid may be getting this and you don't know. If you're missing, pieces. So really stay on top of it, right? So if you have concerns, communicate. And I'm just going to go on a tangent for a second. And I have to laugh a little bit. Don't be afraid you're annoying. I don't think that's a problem for anybody in this room because we're going to assert ourselves when we need to. But it was funny. I was dealing with something with my own daughter's situation, and I was waiting on communication from the assistant principal. And a friend of mine who's in the field was saying, if you haven't heard from him, email him again. And I was like, well, I just sent it early this morning. I kind of like to give it a day. And she said, well, it's not like if you wait till tomorrow, he's not going to think you're annoying. You pretty much established that you want this information. And the only reason I share that with you is because I think I can comfortably say on behalf of all, or most educators and administrators anyway, they know why you're invested in this. This is important to you. And you might email multiple times a day. I don't want that to hold you back from getting information that you need. If that's what you need to do to get the answer back, yes, watch yourself, don't email every 15 minutes, but there's nothing wrong with reaching out and saying, just making sure you got this email, really wanted to get this information. It's okay, is what I'm saying. So let's go to the next slide. I don't remember, okay. So did you want to go over, this is a slide that Kristie and Liz put together. These are some examples, I don't know if it's exhaustive or not, of building level supports that are reflected in this school district. So did you want to talk a little bit about some of those?
So when Kristie and I started talking about the supports that are available at the building, I immediately jumped to the presentation I usually give to the parents of children through CPSE who are transitioning to kindergarten, when we talk about that transition from CPSE to CSE. And the reason that I wanted to jump to that presentation that I usually do is because I often talk with the preschool parents about how they need to advocate for services for their children through preschool, because through the preschool they don't have the resources that are readily available to us in the school district here, in the public school system. And we do have these resources available here. So whereas in order to receive any supports or services from, for instance, a speech therapist at preschool level, you need to initiate a referral to the Committee on Preschool Special Education to determine eligibility, determine that your child's a child with a preschool disability, and then you would receive services through an IEP. However, when you come into our school buildings, because we have all of these therapists and resources under one roof, you may not necessarily need to be a child with a disability to benefit from the interventions that we can provide to you through the building level supports. So this represents just a small sampling of some of the supports that we're able to give to children that are not necessarily classified with disabilities, and some that are, in our buildings, because we are a public school district with these resources. So we certainly have counseling. We talked a little bit about reading intervention and supports. I just mentioned speech services, ESL services for students that are learning other languages. Who do I talk to? Okay. Responsive classroom and classroom management strategies to address behaviors, positive behavior intervention supports, and the multi-tiered system of support that we talked a little bit about before.
There are some slight differences between some of the elementary supports versus the high school support, really given the nature of the age and the changing needs as you move forward. So there are some things that the high school may be offering. Again, I'm such a secondary mindset, but there are some things that the high school may have opportunities for that are I could put underneath the responsive classroom component, and it follows almost that tiered system. When you look at when you think of that triangle picture where it's your bottom, the largest section of the triangle, that's your in-classroom kind of supports. That's more of that responsive classroom. Some classroom management components that could be with the teacher themselves. They may need some guidance through the social worker or a psychologist to help with that in the classroom. That second level, and I'm such a visual person, that second level of that triangle that you can visualize, maybe some more of some pull-out support. So if it's with the reading teacher, more elementary, maybe with the speech component. Sometimes it's the counseling, one-on-one, or a counseling consult where you have a social worker or a psychologist that are working with your child's team of teachers to help support. May not require that one-on-one kind of intervention.
Yeah, I just have a quick question. So, is there a behavior, like within this construct towards the bottom, would a behaviorist be included within like PBIS, and is that available at the junior high level?
We're not a PBI positive. PBIS.
I don't know where it gets classified, but is there a behaviorist at the?
So at each of our buildings, we have psychologists that are working with us, and all of our psychologists have been trained in developing functional behavior assessments. So certainly it may come from that perspective.
Okay.
Do you guys have district-wide PBIS here?
No.
Yeah, we don't have it in my home district either.
We don't have PBIS.
Does everybody know what PBIS is?
But
Please explain.
We use
We
positive
use
behavioral
behavior
intervention,
intervention, but
supports
PBIS
in the
is like
classroom. But not a tiered system
Correct.
that's clearly defined.
Yeah,
I don't know what you mean.
Just so you know, it's not, PBIS is basically positive behavioral intervention supports. And it's a system whereby you are supporting students who may have some, what we call negative behaviors, and rather than disciplining them for it, we are replacing them with what we call replacement behaviors. But when you have a PBIS system, which again, some districts do and some districts don't.
I think I'm asking something different. go, keep going.
Okay, I just want to make sure, because
Yeah.
I don't like to be using acronyms if people don't know what we're talking about. And actually, the PBIS system is like similar to these multi-tier systems. Okay, so behavior, it's kind of like RTI, but for behavior, right? So your PBIS means that your classroom teacher is going to use behavioral strategies for everyone in the classroom. But your child may need more intense, specific, individualized strategies.
It has to be
And
noted on.
no, this is
It's all
before you
just
go
in
to an
place
FBA.
already. It's just.
This is just
Right.
a general
The way they
education support, so we don't necessarily call it PBIS, but it is happening within the context of the classroom environments and sometimes in the school environment. It's like we have the Bell 4 core. We don't call it PBIS, we call it Bell 4 core.
Right.
It is, for those of you though who have students or young people close to you who have behavioral issues that impede their learning, this is a really interesting topic, and the research is really pretty clear that when you do have district, it's hard to put in place, but when you have building-wide or district-wide protocols, it's just more of a foundation for that to work than when you have teachers in different classrooms kind of doing it their own way. But it is something to explore, and it's the reason why even when your child has an IEP and is struggling with some behaviors, you don't always have to jump to a functional behavior assessment. Sometimes the committee explores classroom strategies, management strategies.
Right.
And PBIS is just a system that recognizes that some kids need different levels of support. Right? That is really oversimplified. If this is of interest of you, I suggest that you Google it. There's actually trainings that you can attend on PBIS through the local BOCES trainers. It's a really, really interesting topic. Yeah.
Do you want to go ahead? Do you want to?
Yeah, no, I'm
back,
sorry, I'm just-
piggyback onto your.
I apologize if I went off your question, but I wanted to explain that.
I totally didn't.
Yeah.
Specific questions.
Mhm.
So executive functioning issues, someone told me that to ask if the district had a behaviorist to help with executive functioning.
Mhm.
Does the district have a behaviorist that works specifically with executive functioning issues? Which feels different than than what you're discussing here.
So we've done a lot of work this year in particular on executive functioning. And again, our psychologists are well-versed in executive functioning throughout the buildings and are good support. Also our special education teachers, and all of our teachers have been trained and spent some time this year with Dr. George McCluskey, who is an expert in the area. So it's something that I would say, as far as a specialist goes, certainly I would put the school psychologist first, and then I would look to the teachers who have
So
had
that is a
specific training
resource
in
that
those
when I'm
areas.
working with the
Those are
school, I should
resources,
say,
yeah.
not that I need a behaviorist, that I need the school psychologist to help with executive functioning issues.
Well, I think executive functioning sort of spans a broad base.
Okay.
It's a broad stroke definition of some challenges that students may be facing. So I think that you have to really delve a little bit deeper, if you're talking about your child in particular, what specific components of executive functioning need to be addressed and how do they need to be
Okay.
addressed?
But that's
It doesn't
available.
necessarily
And I can
require
certainly dig into it
intervention
with
from a
them, but-
specific
but-
person
And
to do that.
Right, and I would contact your teacher because there are some in-classroom interventions that can be put into place
No, I-
for students
yeah.
that need
Right.
more.
Just so you know, we have a PTA subcommittee that deals with executive functioning. So I can reach out to me at the end. I'll give you the contact
Okay.
info if you don't know it already, because they're doing a lot of work with parents, and we've done so much work with the school this year in school districts. So we can bring you up to date
Okay.
on some of that.
Yeah.
I just want to say that Dr. George McCluskey's presentation is on the Chappaqua Central School District's website, and I thought it was excellent.
Yeah.
And if you want to see me after, it's hard to find on the district website, so if you see me after, I'll help you find the link.
Yeah, and it's a super good resource. I've had it, we saw him several times because we had the chance just to attend his presentations to different teacher groups and then also to the parent group. And I would say definitely learn something new every time.
And did he present to all the teachers?
He did.
He presented
did.
to all the teachers in the district.
Other
Does
questions?
Yes. Does the PBIS replace the CIT that they have in preschool?
So the CIT is a special education itinerant teacher, so which is a different term for special education services in preschool special education than in Committee on Special Education for School-Age Children. We do have special education teachers here in the district that work with students in the classroom. Oftentimes the service here would be called consultant teacher. It's very similar to the CIT services.
Okay, so
Yeah.
it's not
Does that
connected
answer
to
your
PBIS. Yes.
Okay, yeah. So again, I think that Stephanie alluded to that PBIS is not necessarily just a special education service. It's really something that's broad-based for everybody. Okay, and these are, again, building level supports that are available to all students in the district, not just students with special needs.
Specific to our district, how does it work in terms of how many specialists we have in the buildings? Like, is it, I know that, elementary school, I guess, the three kind of share, or I guess I'm trying to understand what the proportion of students with, that are, qualify for special needs, and how many people are there to support them. You know what I mean? So obviously if there's a need, we need to fill that. But what is that ratio? I mean, how does that kind of get worked out? Like when, I guess I'm new.
Caseload, is that what you're asking?
Yeah, I guess, I'm new to it, so I just don't know.
I don't want to brush off your question, but I think I understand your question. Because my home district is a large district, and we have maybe, I don't even want to say because I don't even know, but I think there's 2 or 3 contracted with the district behavioral specialists, and they float to different buildings. And I'm sure that if you ask anybody in my district, there's varying opinions about whether that's enough, right? But I don't know that that's a conversation for here.
Yeah, so
I just want to, so I think what I'm saying is I think that it's probably a determination that's made based upon that specialist, and when they debrief at the end of the year, I was way over my head, or I couldn't do all this work, it was too much for me. It's really, like you're saying, it's a what is it, supply and demand question, right? It's a caseload question.
Right.
So I just don't, I want to get to the other slides, and I'm just going to rudely interrupt you and say, can you talk about that with the district
I
after?
we were talking about, specific to.
Yeah, well, I think because these services are not particular to an IEP, it becomes a different conversation. When a service is provided in an IEP, and I don't know, Jimmy, they have to provide it.
Have to provide.
Right?
Right. No,
When
I'm
it's
not,
really,
I'm just learning about it.
Yeah.
right.
No, and I think because I think you were asking about staffing. I mean, the staffing at the buildings may differ based on the needs of the building and the students with needs in that building.
Right.
So, we could say that there's, one psychologist at each of the elementary and middle schools.
Right.
We could go through all that. But
that's great.
We might want to.
I guess just as kids get added.
Yeah, I mean, but
Does that
I
get-
think Stephanie's point is well taken in that, if we've made a recommendation for a service, the service needs to be provided. So we have enough staffing to cover.
And that's why, and again, I only know from the limited times I've gone to my Board of Ed meetings, right? When it comes time of year where they're doing those budget reviews, and you go in and they start talking about, well, we're going to add this specialist or that specialist. As parents, we have an opportunity to go to those meetings and put in our 2 cents and say what we think. But that would really be, I would imagine, the vehicle where you would do it. Or if you have you could speak to Kristie or Liz about, that would be my recommendation. But these services are really, it's great that they're available, and certainly if there was something you felt your child needed and they didn't get it, certainly go have that conversation. But I don't know that there's any black and white ratio that they have to meet.
Yeah, there
right?
aren't.
So a lot of times if you have an issue with your child, a lot of the times the question you get back is, well, what do you want? What do you suggest? What would you like to see for your child? Is there somewhere you can go, like on the district website, to find out what are all these things that, you could make your own judgment going into a meeting about what you would like to talk about, because you might not know about any of these things as opposed to someone, with your background.
There's a continuum of services.
That's through the CSE, so that's clearly on our website through our special education department, where it does have the list, and Lucille's right that it has the list of the continuum of services and the programs that are available, K through 12. Part of general education, again, this is more building level supports. Not all of them may be on our special education website because it's for general education students, but typically these areas are what the types of staffing that we have available. I can't say, and I'm looking at the high school, I don't think that some of their clinics are not necessarily part of their course syllabus, but that's a building level intervention. But that's available. That's something that's available on the high school webpage when the clinic schedule is posted. So So, but that's, more the secondary, that may be a question because you're dealing with much more than one teacher, it may shift on who your contact person may be to find out some of the building level supports where you may disagree, but I would say maybe more at the elementary level, your classroom teacher, maybe your first go-to to see what are the overall building level general education supports available. But then as you move into the secondary grades, the school counselor may be one, because middle school is team-based, so they're all together they're together all the time. High school, your school counselor may be the person to ask as in regards to building level services.
Also, just a pitch for the Parent Center. When you are preparing for your meetings and those kinds of things are going through your head, like, well, these are the things I'm struggling with, what kinds of things should I be talking about or asking about? That's a big piece of what we do. So you can call the center and speak to any one of us and have that conversation. And not that we're going to know the ins and outs of every clinic and every single thing that's available in XYZ district, but we would know enough to say to you, you know what, why don't you ask if they have this kind of support? Or just, even if it's as simple as helping you verbalize what your concerns are and then saying, what do you have in the district that could support this, so that they can then respond and say, well, we have this option or this option or this option. Because it's not real, there's not like, aside from the continuum of services, it's not like any school district is going to hand you a menu and say, please pick what you'd like to have. Number one, because it doesn't work that way. And number two, because it wouldn't really be a clear list because of how overlapping things are. You've got gen ed, you've got 504, you've got special education. So it is sort of, and I think, if I could just, be all-knowing for a second, when the people on your CSC from your school district say to you, what do you want? I don't think it's so much what do you want, I think it's more what exactly are your concerns and what needs are you looking to meet, right? And that's really what we're doing at the CSE, is having that conversation. So you can call the Parent Center anytime, and we will help you sort of create that bullet list so that you can, dive through the emotion and your exhaustion at that point and say, oh, right, these are the 5 bullets that I talked to Stephanie about. This is what I want to talk about at the beginning, right? Okay? I want to move on a little bit to the CSE process. Just quickly, in your packet, there is a 4-page RTI guide for parents. For those of you for whom this was interesting and you want to know more, this is a little bit more detail from the state about what response to intervention looks like. Also in your handout, which you can follow along as we have this discussion, is a flow chart of the Committee on Special Education process. Okay? So that's what this diagram is. And at the very top, you will see parent referral. Okay, the actual referral of any child for special education can be made by a parent. It can be made by somebody in the school district. It can be made by an agency if the district has agencies providing physical therapists or other kinds of related service providers. Those professionals can do so as well. Or if there's an education program, if your child is going to school out of district at another educational program, they can make that referral as well. That's really more of a, when you're in preschool and you're at different programs and it's outside of your district. If this is something, can you just go back a second? If this is something you would like to do as the parent, it is as simple as writing a letter to your special education department, specifically expressing what your concerns are. Okay? The reason I say that is because we're going to talk about this a little bit in a few slides. The determination of which evaluations are going to get done. There are some basics that get done, but if you have a specific concern in the area of fine motor skills, you want to say that in your letter, so that occupational therapy is definitely one of the disciplines that observes and conducts an evaluation of your child. And then regardless of who makes the referral, this is important. Sometimes things fall through the cracks more in bigger districts, but just be aware that until you sign that consent, it doesn't matter that you made the referral. You still have to sign a written consent that the district will give you that says, yes, it's a green light to evaluate my child. And that's when your clock starts ticking, is when you sign that consent and get it back to them, okay? So, you can go, okay, sorry. You can actually go to the next slide. So once you sign that consent, and this is a little bit confusing, just because they like to make us think, okay? You have 60 calendar days, so 2 months basically.
That's weekend, that's including Saturdays
Including
and
weekends,
Sundays.
from when you sign your consent. 2 months in which the school district is supposed to have all of the evaluations conducted and you hold your eligibility meeting. they have 60 school days, so Mondays to Fridays minus any school holidays, in which to start providing services if in fact eligibility is found. Should I say it again, or you got it? So it's a little bit longer.
It's like
Right?
3 months.
It's going to come out being longer, right? Which makes sense because they've got to put all that in place and find the providers, and if your child has to change placement, they have to get all that in line, okay?
And we also.
So those are your timelines.
And we also really do abide by our Board of Education dates as well, which need to be taken into consideration too.
Thank you, yes.
So that's important. I mean, I know some districts do a little differently. We really do follow the way in which it should be followed. So I'll make it up, say if board date is today, the start date of an IEP typically is the day after the board meets. So that's just so for you aware, just because we have a meeting, and even though it's those 60 school days, we are very, very aware when our board dates are to ensure that we are within that 60-day time frame. Just to
Yeah.
another point.
Okay. Can you go to the next slide? So, with your initial evaluation, and of course this slide is taking into consideration that there aren't any specific, I'm worried about I don't think my child can hear, right? I want to do an audiology. If that was in the letter, that's going to be included, right? And that's really this other assessments piece. But right off the bat, they're going to do a physical evaluation for gross motor skills. They're going to do a psychological evaluation, okay, which likely includes appropriate aspects of IQ, okay, depending on the student. A social history, which is sometimes a phone call or an interview with a parent. A classroom observation, okay? A functional behavior assessment, if that's the area, if all the PBIS and the classroom strategies did not work and that's what you're concerned about, right? A functional behavior assessment is going to be part of that evaluation. This level 1 career assessment is actually not even called the level 1 career assessment anymore. I kind of leave it there because people who know what it is, that's what they know it by, but eventually we're going to have to phase that out. Your level 1 career assessment is your first of many age-appropriate vocational assessments, which the state wants the districts to be doing starting when the child is 12. Okay? So, if you refer a child for special education who's 12 or over, that level 1 career assessment is going to be part of the initial evaluation. Questions? Whenever there's no hands, it's either everyone knows what I'm talking about and they're bored, or they have no idea what I said.
Here in district, we also do an educational evaluation. I think based on the regulations, oftentimes that's lumped in with the psychological. If we do like a psychoeducational, we do the educational separate.
Right. Yes.
If the child is approved prior to this, when they hit 12, do they then have to do the level 1?
Yeah.
So it's not just to get
No.
eligibility, it's just once
No.
they hit 12 that
All
you have to do
children
it.
age
That's why
12.
it's 12 or over, because for those of us who the disability was from birth and you had special ed all along, when you're like, I had to actually call to get it done this year for my daughter because she's almost 13, but since I had her held back, it wasn't on the radar because they typically do it in 7th grade. But then they did it once I called, right? So again, it's that communication, right? Okay, parent is a member of the CSE and must have the opportunity to participate in the discussion of which assessments or which data is needed. So once all the evaluations are done, and we were just talking about this before, and you get your packet, right? That you have to sit down with your pot of tea or your bottle of Sauvignon Blanc or whatever works for you and pour over these reports. At that point, you're going to go to the CSE eligibility meeting and have a conversation, and part of that conversation is going to be, do we have enough here to make a decision? Okay, I want to go off a little bit my script here, because I want to mention something that it's going to come up a lot in the CSE process. If that were to happen, it's obviously going to impact your 60 days, right? The reason I say this is because a lot of times, I know nobody in this room, right? But sometimes parents of students with learning differences get emotional and anxious and impulsive, right? The reason I'm saying this is because missing a deadline is not always, a reason to shout fire, right? Because sometimes things get delayed, and sometimes it's our own fault, right? If I go to a CSE eligibility meeting and I say, you know what, I really think we need to look at audiology because I see the speech results and I feel like something else is going on, right? Or if the speech evaluation said, I would recommend an audiology evaluation, right? Then that CSE has a couple of choices. They might say, eligible anyway, let's move forward. Or they might say, if that's really the only area, we can't really make a decision yet. So the point here is that you are part of that conversation, you are part of that team. Okay? Questions? Okay, in each component area, the evaluation report that you ultimately get from that service provider who conducts that area, whatever it is, fine motor, gross motor, speech, behavior, these are really what they're looking for, okay? What can the child do, what can't they do? What are the child's strengths, right? This whole process is very strength-based, okay? We're supposed to be identifying our kids' strengths so we can build on them. What are the parents' concerns? Did I talk about the parent concerns in my report? What special factors might be part of the conversation for this student? Okay. What happened last year? And this, whether we're talking about initial eligibility or reevaluation, what was the child's progress last year and how did that match up with what we expected the kid to do? Okay. What is it about this student that impacts their performance in the classroom? In the general education curriculum, what is holding them back? And what works and what doesn't work? And for those of you who've sort of been at this party for a while, you will notice that these are a lot of the things that the CSE talks about every year, right? So this is the first time we're looking at this, so this is the information that we need to make that eligibility, to have that eligibility conversation. Okay, this is a big slide. This is an important slide, because most of the parents that I've helped on this topic in the last couple of years, this is where there's a disconnect in their understanding of eligibility. And it is that eligibility is a two-pronged determination. Having a disability, and actually in your packet, do I not have that here? You have, oh yes I do. You have a back and front handout that has the 13 special education classifications. Okay? Being able to put your child into one of those categories is only half of the discussion. Okay? And because it's at the top of the list and it is prevalent in today's society, just because a child has an autism diagnosis does not mean they qualify for special education services. No reaction to that? I mean, is that like a big what? Is anybody reacting to that? Because, and you could say that about any disability. Just because a child has Down syndrome doesn't mean that they qualify for special education services. Just because a child has a particular IQ doesn't mean they qualify for special education services. There's no one thing, okay? That's only the first half of the eligibility discussion. The second piece is really the more critical piece, is that something about that child's participation in the classroom, something about their performance levels demonstrates that they need something more than can be provided by the general education teachers and the general education supports. But don't forget about the general education supports. Don't forget about the RTI. Don't forget about the reading specialist, the behavior specialist. Because if they can do it, then we don't need special education services, right? So you're only going to get an IEP if your child needs something that cannot be provided without an IEP. Does that make sense? Okay. Let's go to the next slide. So when we are considering eligibility, we talked about general education supports. Is the child going to need what we call specially designed instruction? Okay. Are the teachers, regardless of their placement, I'm not talking about placement here, is the teacher responsible for educating the student going to have to particularize the instruction for this child? Okay? Is the teacher going to have to go a different way with the student because of the disability? And again, none of these are, the end of the conversation. Okay? It's very important to remember this is all a totality conversation. You have to consider all of the factors. And does the student fall into one of the 13 categories? Okay, these are the considerations. And in your packet, there is an eligibility checklist. Everybody have that? These are a list of eligibility considerations put out by the state for school districts. okay? And I'm not going to go through all of them. Feel free to chime in, throw your hand up if you have any questions about any of them. But these are the considerations, just to name a few, right? Does the evaluation information provide sufficient information to determine this child has a disability and falls into one of those categories? Has the CSE considered whether or not limited English proficiency is a determining factor in that child's performance? Or, where is it? Has the CSE considered whether lack of appropriate instruction in reading or math is a determining factor? And that doesn't mean, was the teacher not doing their job? That means, did we do RTI? Did we try to support this child, right? I wanna talk about something that's not on any of my slides, not in any of my handouts, and it's just sort of part of my shtick that I have to share with you. The special education eligibility determination is something that is seen as good or bad depending on who you talk to, okay? And the reason I say that is because depending on what our personal experience is, right? I have a little girl with Down syndrome. I have no choice. She will have an IEP always, right? I mean, I guess I shouldn't say I don't have a choice. I guess I could have said, no, thank you, I don't want the IEP. But I don't know who that would have served, right? But that is always an option. You can always say, I don't want special education services. But my point is, it's highly unlikely she's ever going to be declassified, right? But then you have a whole other population of parents, right? Whose children feasibly could get what they need through general education supports, or maybe a 504, which we're going to talk about. And those families, I feel like, are often, and rightfully so, they're anxious. Is my child getting enough? And it's that whole more is better thing, right? You can get more with an IEP. There's more, and there's no doubt, there is more available through an IEP. I just want to throw out for consideration that it is not, that IEP is not like the Willy Wonka golden ticket that everybody wants. It's not. It's not. And I say that lump in throat as the mother of a child who will always have one, because the bottom line is that I don't care how good your district is, I don't care how good your teachers are, statistically, those kids have poorer outcomes. Those kids have higher dropout rates, lower graduation rates. There's not really any getting around it, okay? Now, a lot of that, for me, is swallowing that pill, right? My daughter's doing great. Don't get me wrong, she's doing fabulous. Fabulous, right? Her mom's got a big mouth, right? She's gonna do fine, right? I can't pull that IEP from her, right? Will she graduate with a diploma? I don't know, right? We're gonna navigate that. That area of the law changes every 5 minutes, right? Of who gets a diploma and how. But my conversations at my meetings are about what are we doing to increase her skills? What are we doing to increase wherever she's the most weak, right? Whether it's social, behavioral, academic, whatever it is, right? I'm just saying, I'm not saying stop fighting for your IEP. I don't want you to misunderstand me. I'm simply saying consider it. If your child can get by with general education supports and manage his day and do well and be proud of what he did, even if he's not a straight A student, that's success in my book. Yeah.
So I'm just
Please,
thinking
go
about
ahead.
what you're saying. And so are you insinuating through that comment that having an IEP means that they're going to have a lower chance of graduation? Are you saying cause
Nope.
and effect?
Nope, not at all.
That's the way it came out.
Nope, then let me start again, and thank you for that. No, let me start again. What I'm saying is that more is not always better. What I'm saying is that when we put a kid into kindergarten, right, and we've got an eye toward graduation and hopefully some post-secondary success, whether it's in school, employment, independent living, whatever it is, our job as school districts and parents and families and CSE teams is to support that kid and nurture that kid and have him go as far as he can go, right? To become independent, to learn who he is, and to be successful in life. And all I'm saying is that if you leave a meeting, whether it's a 504 committee meeting or an eligibility meeting, and you are left with a feeling of there's more they can do for him than what they're doing, I'm just suggesting consider it. Consider whether or not, I'll give you an example. I helped a parent whose child switched districts. And when she switched districts, Her son went from being in a self-contained classroom with a one-to-one teaching assistant. The new district put him in a consultant teacher model without a one-to-one teaching assistant. Right? Would you have a fit? I would too, okay? Without a conversation, this is what happened, okay? I think we had a conversation in November about it. We had another conversation in March, right? Because really she was like, I know we're new here, I gotta figure this out for the annual review, blah, blah, blah. She called me in February, and she really wanted to know how we're gonna fix this. I gotta, he's not getting what he needs. But she also proceeded to tell me he was doing really well. He was doing really well without that level of support. He was managing on his own, he was bringing home his assignments, he was feeling really good about himself, he was doing well, right? He was learning about his disability, he was learning what management
How old
supports
is
he
he?
needs. This was a 6th grader, okay? So all I'm saying is consider it. Let me say one thing, and I mean this from the bottom of my, there is no right or wrong in this conversation. There is no right or wrong, and there's no, I did this, so you should do this. Every kid is different, every CSE is different, and every education plan is different.
Okay, but also year to year, school to school, requirements, etc., change. They can become more demanding, psychologically demanding, social situations. A kindergartner who may need fewer supports potentially because the social demands are less is not going to be the same as a student in 9th grade whose social demands are greater, who may feel ostracized not being a part of a group. So I just hesitate at this phrase of saying more or less because I think it's more appropriate to say depending on the student's needs
Of course.
at that moment.
Of course.
Because I feel like this is general argument against supporting
No.
is a very
Absolutely
slippery
not.
slope. And
Absolutely
it should be
not.
dependent on the child year to year, school to school, developmental. Things can happen in the child's life that will dramatically impact the way that they're able to perform in school. I just think this sort of global statement more it is not accurate. Whatever. It's
What's
not,
your first name?
Karen.
Karen. I agree with you. I don't like blanket statements either. And if you think about what I'm saying, that's what I'm saying. There shouldn't be a blanket statement that everybody who has needs needs an IEP. That's all I'm saying. Absolutely, the conversation needs to be had. And if the IEP is appropriate, then the IEP is appropriate. I'm simply saying it's not the only way to support. And sometimes we have to watch what the kids do. And we have to follow their lead. That's all I'm saying. I'm absolutely not saying an IEP is better than not an IEP or not an IEP is better than... I'm saying... Did I just throw a paperclip?
I just think sometimes it becomes incumbent upon the child to feel that they need to cope when they actually need services or supports.
But that's a
And
conversation to be had.
They don't want to say that they have supports or needs because they feel they have to be independent and they don't want to have special. And there's such a stigma against special ed still to
Yes.
this day.
And all I'm-
particularly mental health services, that students are not going to reach out. They're not going to say they want that because it's perceived as being weak or inadequate or I can cope, and then the child crumbles
And all I'm
because they haven't
saying...
gotten those supports.
All I'm saying, Karen, is have the conversation. That's all I'm saying. The conversation needs to be had. Right?
I'm fine with that.
And when we're at the CSE and you feel like it's leaning toward less support, mom's going to chime in and say, but what about? Right? And then the conversation
Or
is
the
had.
child, well,
Or the child. Or the child. But I'm just saying have the conversation. Because while you got anxious that I was saying across the board no IEP, which I absolutely was not saying, there are plenty of people who I think are the other way. If I don't get an IEP, I'm fighting. And I'm simply saying have the conversation. Have the conversation about how it can work either way, right?
I do
Let's
hear
talk a little bit more after, okay?
I
Yeah,
do hear a
Lucy.
lot of anxiety about families who call me, who ask that their kids are getting either declassified or just less services, and they're very worried about the school-based supports or whatever, and they feel like they don't have a voice sometimes in the CSE meeting. It's not really like a vote,
Mm-hmm.
you know.
Yeah.
It's really,
Well, it shouldn't be.
well, it isn't, yeah, but but that is something I do feel that I have gotten calls on. I hope those people are here. I don't remember everybody's name, but because it's important for people to understand like what everything means and what are the resources available. as you've outlined, whether it's in the school district or elsewhere, so that they can articulate what they need for their kid.
And I want to say one other thing, actually, at the risk of running out of time, but I think it's important. And it came up, I can't even remember what the topic was, but I was at another workshop, and this topic came up. And I only want to share it, and you know what, if it doesn't fly with you, just throw it out. But I always reminds me, this process, believe it or not, always reminds me if there was a time, not now, when I was a very dedicated Weight Watcher, right? And anytime you went to the Weight Watcher meetings, the leaders always said the same thing. When you got down on yourself and you weren't succeeding and why do you keep doing this? And they would say to you, tell me one other thing in your life that you do perfectly. And the answer is nothing, right? I only say that because, take our hypothetical student. If we decide to increase or decrease services, and we walk out of that meeting having made that decision with a knot in our stomach, and 3 months later, things are tanking, or 1 month later, we're going to go back and weigh in, right? And say, what did I do wrong? Let's go back to the drawing board. This is not working. And that's the beauty of this process, is that you can call and have a meeting whenever you want. I don't know that you always need one, but you can call Liz and Kristie whenever you want. Or your social, who's the case managers in this district? Is it your classroom teacher or your social
Were classified as special education teachers.
So your special education, whoever your first go-to is, you can reach out whenever you want. This is never going to be perfect. And the other thing I always say to parents, the IEP, which we're going to talk about next, even if you, and I don't know anyone who's done this, but even if you have crafted the perfect, impenetrable IEP, that's only the first step. It has to be implemented and work, right? So it's just, I guess what I'm saying is forgive yourself and your CSE if things are not perfect all the time, right? Because our kids are books to be read, right? We don't know where it's going to go, right? So my whole thing as Parent Center is don't stop having the conversation. Don't stop injecting yourself into that conversation and insisting on things and asking questions and demanding information and really fleshing everything out to figure out which way to go.
The other thing, I'm sorry, I just want to say one more thing, is also, my child is in like the end of high school now, and I'll just tell you some experiential stuff. Over the years, there's some point that there's like an inflection point where you start saying, how much more can my child do on her own? Rather than having so many school supports, because you start thinking about after high school. So whether it's working or secondary, post-secondary education, at some point they have to do stuff.
That's the point I was trying to make.
Right.
Thank you.
And whether like again, my own daughter fairly is one of the more significantly challenged students in the whole school district. But this year, we stopped having a monitor on the bus, and she stopped having a TA walking her back and forth down the hallways at the school, because as an adult, she's going to be, even if she's in like a program, she's going to need to be able to like go to a place and come back to the group, go and come back by herself. They don't have one-to-one TAs in adult world, right? So again, that's a fairly extreme example, but like you start having to think like that. And the things we've done for college-bound students, it's like kids need to be able to wake up themselves in the morning without you getting them up. They need to be able to figure out what their issues are so that they can do their own homework. Like you don't have that in college. So
I just wanted to make one more point. I'm
Yeah.
sorry. But it's
Don't
just in terms
apologize.
of mental health, and that we've had several workshops here. We've had several experts come in talking about mental health issues, particularly anxiety, which were incredibly well populated. We had 90 parents at one. And one of the things that the mental health professionals stated was that children who have, say, anxiety that is not dealt with can lead into depression. And then that depression then can lead to suicide. So that's why it's incredibly important that maybe your child may not be manifesting it, but they may be feeling it. And that if it's not recognized, or it can behaviorally come out in other ways, it's why you have to track it, because we've had issues with students who at high school have just imploded. And they have had services, but it's very difficult. That's my only concern. If you're going to feel like the kid's doing okay and you're going to pull back services on him, you may be pulling them back at a time when the child is very vulnerable, entering particularly transitions from elementary to middle, from middle to high school, from high school out. Very stressful, very difficult. Pulling the services back at that time may not be a good idea because the kids may need even more support, but they can't voice it because they're so on their own, saying they want to be able to I can be like the other kids, I'm going to go to Harvard like those kids are going to be going, and that's my only concern, just that from the mental health perspective and from the experts that we've had come in here and speak, and we've had 3 or 4 of them, that it is important that everyone is aware of this and tracking it and following it. And I know that our district does have a lot of mental health supports here, but it's something that even with those supports, we've had very serious issues.
And no one is going to verbalize that it is CSE better than you just did. And that's why it is
But your
incumbent
child
on
may
parents.
not, and if the parent, because I'm so in tune to it.
But that's what I'm saying.
Not,
That's what I'm saying. As parents, if you were a parent that would go to a meeting and just timidly sit there and listen, you're not going to express that. And we need to do that, whatever the issue is. And if for such a grave issue, absolutely, you need to voice that and share that concern and make sure it gets included in the consideration. Well, going back to what you said though, Lucille and I have a wonderful director at WIHD at the Parent Center, Naomi, who some of you know, and she always says when we're talking about, not mental health, but when we're talking about self-regulation supports and behavioral supports and management supports, and she always says, for every support you put in place, that's one more thing your child's not doing for themselves. And it's important to remember, right? I would love to pull my daughter's one-to-one. I would love to. But she's still doing so many things that a 4-year-old would do. I can't. I mean, I could, and maybe I will at some point and experiment with it, but at the same time, she's got that one-to-one, and a result, she can't manage her own homework, and what do I need to bring home, and because her TA does it all. And trying to support that independence. Some districts actually have an independence plan that they'll attach to the IEP. Mine doesn't, but where it actually maps out, what are we weaning this kid off today? And that's really the TA's main job. Not today, this year is what I meant.
I mean,
Right.
My son
But
is
again-
young, but the point is to teach him
Yes.
while we can, the tools that he needs to use in his bag to do the stuff that we're asking, so
Right.
that
How old is he?
he's only 7.
Yeah, so you're gonna blink and you're gonna be in 7th grade like me, and nothing,
but the idea is to not
but be aware of
do it
that.
for him, but to
Mhm.
give him the tools for him to do it himself, because again, as parents, we're there to kind of put the bumpers up, like
Yeah.
when you're bowling,
Yeah.
you put the bumpers up, we're those
That's
bumpers,
right,
but then
that's
to
right.
go down the
That's right. But Karen, just to get back to your point, Karen, I think that what you bring up is really a medical issue. It's a treatment issue. And it really is something that, no different than if my child had some unique condition.
Hold on a second. Hold on. I'm talking about.
You're talking about mental health.
Yes, but I mean mental health within the school system is also treated by reduction of stress, which is also treated with how things are presented to a student, like say material is modified so a student doesn't feel overstressed, or homework requirements are reduced because that student may not be able to complete it due to their anxiety over the issue, or certain social situations are monitored and helped through the use of a counselor. So I hesitate using the term medical because it implies that the child has to be medicated or that, and so
I am not doing a
terminology-
good job communicating it. That is not what I meant. I meant that it is a legitimate health concern that mom needs to bring to the table, just the way I would have to bring it to the table if my child had a rare condition that needed to be factored in making decisions. That's all I meant. I am not the person who would ever suggest medication. Absolutely not. Yes.
Can I just in relation to what you just said, one thing to keep in mind with your TA, if your child has a TA, is some TAs are, especially young ones, are very nurturing, and they do, so even though they know it's good for them to become independent, they tend to do a lot for them. So my child is now in high school, and on his IEP there are study skills that you can actually put in there. And part of it is now he writes his own homework down. So make sure that you take a look at that part of the IEP. And if you're concerned, you think he's ready to take on incremental things, if you put it in there, then it just helps to make sure that the TA is all on it.
Thank you.
Thank you.
And the other thing I think, just piggybacking off of that a little bit, times even before you are getting to the CSE table, are those conversations with your child's team and the teaching, that may not be directly with the teaching assistants per se, but trialing, pulling back a little bit. So then this way there is some information to say what worked, what didn't, why did it work, why didn't it work, to help, I think, really guide some of those more formal decisions that are made through an IEP too. And I think just in general, even though it's not necessarily a teaching assistant component, that's one piece, because that would be through specifically through an IEP recommendation. But even having those conversations through from bringing it back a little bit to the general education supports too, of trialing what worked, what didn't, and it's the same kind of different ends of the spectrum, but same kind of theory.
And I think that a good thing that I've learned through working with you too is sometimes when you start off, you think an IEP, it covers the whole year. So it's like, oh, by the time, now we think about next year. But we do a lot of, let's try it out for the first 2 months. You can always come back to me and add or change or something like that.
That's what we do with our
Go
kids,
back
right?
for
If
another
something
Exactly.
doesn't work,
Exactly.
November,
towards
let's
them.
meet again and see how
Right.
this is going.
So it's a very fluid.
Yeah, definitely.
All right, going back to the book. Just quickly, because I think most of you know this process, but I want you all to be aware of the Guide to Quality IEP Development. Essentially, the job of that committee on special education is to develop the IEP, develop the special education program. And this is an excellent guide. It is a bit dated, it's 2010, but there's not enough changes that I'm not still recommending it as an excellent resource in understanding the components of the IEP and how the CSE works to develop it.
I'm gonna just put in a plug for that old parent guide too.
Yes,
That's
oh, yes.
Really, really helpful.
It's really
Even though
old.
it's ancient.
93 or
We
something?
send it and we
Yeah.
use it and we hand it out.
Well, until they replace it, right?
Right.
So, and the CSE's job really, I think Lucille brought this up earlier, she used the word vote. And a lot of people have this misconception that the CSE, actually I even was told by one parent that their district actually does hold a vote, which was a little unsettling, but your CSE discussion and determination on anything is supposed to be just that. It's supposed to be a discussion until you reach consensus on what would be best in that area that you're talking about. If that consensus cannot be met, it is the responsibility of the school district representative running the meeting to make a decision on that. But it is not, everybody raise your hand if you're in favor of this, everyone raise your hand if you're not. Because that's really uncomfortable. I mean, it really should not. But it's supposed to be a conversation, and it's okay. It's okay if everyone at that table thinks one thing and you think something else. You could say, could you please have the IEP reflect that I don't agree with that? And then you can, there's a couple, and it's not really, it's kind of a different presentation, but you have a couple of options at that point, and they're not all adversarial. They're really not. But again, you can call the parents in if you have questions
I
about it.
think just, and our meeting was nice and but I think that because from a parent perspective, to see it as like this vote, you walk into the room, and this is the first time, or maybe, that the parents have been at the table, whereas everybody else sitting around the table has been there multiple times, So just from a psychological standpoint, I think, and this is just the nature of the way that it is, that parents feel, unless they have a parent advocate, even so, it's still 3 people and there's, all these other people there. It's just intimidating whether,
Yes.
I also think
And Kristie and I always say too, we're both parents
right.
and we both manage our own children too. And we've
On the other side.
Right.
I mean,
we've been on all sides too, so we get the parent piece
Right.
too.
So that's
It doesn't make it any easier, but we try to be as understanding and sensitive to that as we can.
Yeah.
We know it can be an intimidating
It is,
process,
especially
and I
because, again,
understand
we're
why.
so emotionally invested, so it's like your emotion is leading, and then all of a sudden it's intimidating. Again, I didn't have that, experience, but I could have, but
Do you go alone?
me? No, my husband.
That's good.
Oh, we don't do any, no, we don't.
So guys, the next couple of slides are a little bit particular to kind of a sub-issue, but it's one that I think is really important because people get confused about it. It's also relevant to our discussion. because when we start to talk about the differences between a 504 and an IEP, this becomes very relevant. Okay? The words accommodation and modifications are both things you can see in an IEP. Many people utilize these terms interchangeably. They are not the same thing. Okay? And accommodation, and you see that's supposed to be a finger reading in Braille, right? It came a little big, so I'm not sure what it looks like, but an accommodation is something you do for a student that changes how they learn the material. Okay, what's written there in Braille is the exact same thing that Joe Typical is going to read, only he's going to read it in a regular book. So this child is not being asked to do anything different. They're just doing it a different way because they have to because of their disability. That was the simplest example I could give. A modification is changing what the student is learning. Okay? I picked a map because all I could think of was this year when my daughter's 6th grade social studies class was learning about the continents and the regions of the world and the oceans, and they were asked to write sentences about different regions and the civilizations. A lot of the work that she did was on her iPad identifying the continents. Or she had to tap on, show me one country, one continent that is below the equator, right? So she's doing the same topic, but she is by no means being asked to do what the other kids are doing. Does everyone follow that? Because of her disability, she cannot do grade level work. That's the difference between the student with the vision disability and a student with an intellectual disability. And that's not to say that that's the only disability you get a modification for, just those are my examples. Does everyone understand the difference? Okay. So the next slide actually, just says what we just talked about. But if you go to the next slide,
Wait,
and
can I just ask a question about
you want me to go back?
Just for the modified.
Okay.
My son is modified,
Can you
but
go
he
back?
doesn't have a cognitive disability.
No, that's what I said. It doesn't have to be a cognitive disability. That was just my example.
But it says they're reduced or simplified due to cognitive aspect of disability. But it doesn't, for my son, it's modified because it's too stressful for him to handle. Like,
Okay,
the full
so maybe I
course
should
load.
change that slide.
It just implies there that
Thank you.
that's just.
Thank you. So really
people
what I
don't
meant
even ask for less.
is that whatever the aspect of the disability is that makes it necessary, CSE rendered it necessary to modify the curriculum. Thank you. And then the math problems that I labored over to try and make my point is that essentially if this is the assignment that the 4th graders are doing, or 3rd graders, whatever level that would be, I don't know what grade level that would be, an accommodation would be larger print and less examples to do. Because of the child's disability, they work slower, or maybe there's a stress issue, whatever the issue is, they need to be asked to do a lesser amount, or they have more time to have. But the modification would be, well, this student doesn't really understand the parts of a whole yet. So could I give them a calculator and ask them to do this? Yes. And they would learn calculator skills. But if I want them to understand the concept of parts of a whole, maybe I'm going to simplify it to that. That's a modification. Okay? Let's go to the next slide. So your IEP, and Lucille alluded to this before, and I put in red here. Once you get to transition age, which is the year before your child's going to turn 15, these are really the 3 main thrusts of the IEP. We are moving toward education, post-secondary education, post-secondary employment, and post-secondary independent living. So the IEP is a document that guides education, authorizes services, and establishes goals. And certainly once you hit middle school, your focus should really start to be, where are we going with all this, right? We're not doing this just so we can do well in high school. That's not really the goal. There's got to be some reason, right? We don't go to school just to go to school. So that's when you start to consider for your individual child, what's our goal here? And that's going to drive your measurable post-secondary goals as well as some of your annual goals. So let's keep going. The IEP is going to support the child's participation in the general education curriculum, regardless of their placement. Okay? That doesn't mean that they're in a general education classroom. It means that their instruction, whether they're accommodated, modified, whatever, the whole idea is to give them access to the general education instruction, right? So going back to my daughter's map, no one is saying be cured of your Down syndrome and do what all the other kids are doing. They're simply saying, let me give you this map and these apps on the iPad to help you access what we're teaching everyone else. It's all about access, right? The access point is where that particular student can meet the curriculum. And it's different for every kid. Okay? I want to just go a little quicker because I don't want to skip the end. So your annual review, when you have an IEP, you feasibly could have a CSE meeting every 2 weeks, but you are going to at least have one meeting a year, which is your annual review. Yes.
If you have a 504, can you have more than one annual review?
It's not called an annual review, but yes. We're going to get to that.
Okay.
Okay, let's go to the next slide. Jump in if you have questions about any of that, but I feel like I have my AP class here, but if you have questions about that, ask me. Okay, so these are your district-specific, yeah. You want me to go back?
No, I'm okay without it. With some of your examples, it was clear to me, but with something that could arguably be remediated, like dyslexia, are you talking if you need specialized instruction, would that be considered an accommodation or a modification?
Neither. So specially designed instruction is, and I'm not a teacher, but specially designed instruction is I'm the teacher, whether I'm a general education teacher or a special educator, and you're my student, and I am going to craft a lesson so that you can get the gist of what I'm teaching, or if you're not modified, you're going to get everything that I'm giving everyone else, but I'm introducing it a different way. Maybe you're a tactile learner. Maybe you're an auditory learner. I'm going to use different methodologies, and I'm going to do something different for you.
Yes, but if you have to put it into this rubric that's been designed, legally, what rubric do you put it in? Like, is it a 504 or is it an IEP?
I guess it would depend. If I'm not changing the level of performance, it's an accommodation.
Okay.
If I'm changing what I'm expecting of you, and it's different than what I'm expecting, then I guess it's a modification. I think that would be a conversation at the CSE.
Yeah, and I think it goes back to what you said about eligibility. You may be a child with a disability, and then it depends on the two-prong approach for eligibility too, when we think about it from that perspective.
Yeah. Go ahead.
So making a referral to special education varies based on the levels. So if you were to make a referral for special education at the elementary level, you'd get in touch with the building principal, and the building principal would meet with you and go over the referral process, talk to you about your concerns, and talk to you about this process. And as Stephanie had alluded to, some of the supports that are available at the building that might be able to address the concerns, or if that's already been tried and your concerns are ongoing, helping you through the referral process there. At the middle school, you would meet with your counselors, and same process would be taking place. And at the high school, you'd also be meeting with the counselors.
For either a 504 referral or a parent referral to the Committee on Special Education.
Okay. So they're not going directly to any of you at special ed?
We're always available as well.
The process of that discussion taking place and having the referral in your hands of going through that is with the people that we had just shared.
Okay. So Section 504, right? Long last. What the heck is Section 504? Section 504, the reason why it is not a special education initiative is because Section 504 is not in the Individuals with Disabilities Education Act. It's not a special ed law. Section 504 is from the Rehabilitation Act. Okay? It is an anti-discrimination law. Right? And what it says, essentially, is that you can't discriminate against me as a student in your district because I have a disability. You must accommodate me in the way that I need to be accommodated. But it doesn't mean that I need special education. I don't need specially designed instruction. Right? I just need an accommodation. It may be something as simple as I need to be accommodated that I have to self-administer insulin every day. Right? Or I need to be accommodated because I have mild ADHD. So I need extra time to do things, or I need preferential seating.
Refocusing and redirection.
Right? It could be, I actually know some districts, and I think this is kind of up in the air, but some districts have actually given 504s for allergies. I don't know if you guys do that. For different kinds of food allergies. So that kind of sometimes overlaps with health plans, which is also not a special ed topic, but again, I think the whole point of today's discussion is that there's so many ways to support our kids, right? So let's go to the next slide. Section 504 As I said, it's a federal civil rights law. It protects individuals with disabilities in programs and activities that receive federal financial assistance, right? So public school districts. It protects the rights of individuals, any disability, including those that are not visibly apparent, right? Having the impairment or the disability does not automatically make you eligible for a 504 plan. So let's keep going. To have a 504 plan, the student must be determined to have a physical or mental impairment that substantially limits one or more major life activity. Or they have a record of having had such an impairment. Okay, and here comes the conversation of, do I have to look at a medical diagnosis? I mean, if I get one more phone call about that, right? Or being regarded as having such an impairment. Now, 504, I think the biggest way it's different from what IEP, from special ed and IEPs, is that you don't have a 1,000-page body of law behind it. Okay? Those of us who are in the IEP world, the regulations are endless, and we can go research and find exactly how things are supposed to be done. Not exactly the case with 504. With 504, you're going to make the request. You're going to have a committee similar to a CSE, but the way those things are done are very district specific. Okay? The laws really leave a lot up to the school district. Essentially, you can't be discriminated against. You must be accommodated. And as far as your question about do I have to have a meeting annually, most school districts do.
Not do I have to, can I have more than one?
So you could have,
Right.
so on either world, CSE or 504, at any time you can call, the district can, a teacher can, a parent can call for a requested review, some don't call it a program review. But yearly, you have an annual review, and typically you have one annual review. If you run out of time for whatever reason, then you'll have a continuation annual review. But to review the plan for your current school year, and you're not planning for the following, so right now we're in annual review season for both CSE and 504. We're making plans for the 18-19 school year. We're really looking at this current school year.
So yes, you have to have more than one.
Correct.
Who's on the 504 committee in Chappaqua? Is it the same makeup as the CSE?
It's a group of people who know the child best.
Okay.
It's usually at the school level.
So you're at the high school, your assistant principals are your 504 chair people. You'll have a general education teacher on the committee. And at times you may also have a clinician, and the student's school counselor will be there.
Like my son has
and at the secondary level, the child.
yeah, and my son is the reading teacher, so would she be?
She should be.
So if you're coming from CPSE, from preschool, would those teachers also be involved as current providers, or is it only people representing the district that may not have ever?
So from CPSE to Section 504, typically what we do for CPSE transitions, we have a CPSE annual review, and then if a referral is necessary for one of those committees, we take a look. Now, Section 504 is specific to the environment, so oftentimes we're waiting for children to come in to see what accommodations or modifications they may need in the environment.
But it would happen before the school year starts?
Not necessarily.
Okay, so if he needs an accommodation going into the school year, what would be the best way to approach that?
It may be student specific, so I mean we could certainly.
I'm confused by the question. Does your child have?
So he receives feeding therapy right now, but he still chokes frequently, and in his preschool everyone is first aid certified, and at Grafflin I was told some of the staff may be, but it's not a requirement.
So have you had your transition meeting yet?
No, because he's going into pre-K this fall, but he'll be going into kindergarten the year after.
Okay, so when you reach the point where he's going to make that transition from CPSE into kindergarten, you can call the Early Childhood Direction Center, and one of my colleagues there will walk you through that entire process so you know what to focus on, what questions to ask, so that when you leave that transition meeting, you have a little bit of better of an idea of what the plan is going forward.
Okay.
And we'll have a meeting too before the transition. We'll have lots of meetings. So. Okay.
Thank you.
If you're transitioning between schools, will there be administration from both schools or just your school you're in?
Typically, it's the school year, and there are times from the 8th to 9th grade, or there may be a high school counselor on the 504 committee for that secondary transition.
Okay, so there's the last resource that's in your folder is this IDEA 504 comparison chart. It's back in front. Okay, but essentially, these are some of the main differences. First and foremost, one is special education, one is not. Okay? The two different legislations that are governing what goes on in these two realms. Okay? You've got 13 disability classifications under the IEP. Any disability that interferes with learning. Okay, so it's a little bit broader. Federal and state regulations govern what goes on with special education. And district procedures govern what goes on with your 504, barring the fact that they have to provide the accommodation. With an IEP, you have a specific IEP form. Okay, so ours is the New York State IEP template. There is no specific form. I mean, your school district could use a napkin if they wanted to. I don't think they will, but they can have their own forms. They can have their own procedures and protocols of how they go through that 504 process. On an IEP, you're going to have support services, accommodations, and modifications if necessary, right? Including modifications to the curriculum like we talked about. With a 504 plan, the student's going to get the same instructions and materials as students without disabilities. They will be accommodated as needed to meet the needs of their disabilities. Okay? And again, it's all about access to the curriculum. If your child has a 504 and you have done backflips with your 504 committee and you or anyone else on that committee feels that he is not sufficiently supported, it's a spectrum, right? A lot of times kids are declassified from special education and they're given a 504. Well, you could go the other way too. It's a conversation. If you leave this session with nothing else, the main idea, right? The main idea of this entire conversation is the conversation is never over. And things are going to change, right? It's a tough thing about life. Things change all the time. And we have to kind of move with it and ask questions and work with other people and figure out which way we need to go, right? Can we go to the next slide? Thank you. So this is certainly not exhaustive. I can't say that enough. I just wanted to give you some examples of the types of conditions that can be addressed by an IEP as opposed to a 504. Okay, you'll notice I put ADHD on both because that is a very common disability that can sometimes, depending, there's ADHD and there's ADHD, right? Although I hate that expression because you could really say that about any disability, but that is a disability that we see a lot of both in the 504 world and the IEP world. Let's go to the next slide. These are some websites that I love, that if you go to these websites and fish around, you will find excellent resources on these topics that we've talked about today. Topics like what is the difference between a 504 and an IEP? Why isn't my child eligible? What questions should I be asking? The top one is our website. The next one is actually the State Education Department website for special ed. Understood.org is a great website.
Break it down very easily.
Really parent-friendly language on a lot of very heavy special ed topics. Parent Center Hub, a little bit more dense material, but another really good resource for information on these topics. And I think that's the end of my slides. Is there another one? No, that's it. Does anyone have any questions, or please highlight if there was something you wanted to hear about that you didn't hear about, something you'd like to talk about more, something you'd like to talk about less? Yes.
Just to piggyback what you're saying about the ADHD, since it's kind of my focus. You said it's becoming a little bit more prevalent now. So what sort of, is there anything that's being done from state level or that to kind of help catch it earlier? You know, I think that there's so many rules about being able to diagnose it until a certain age, or, you know, is there a way that we can start screening kids earlier and preparing the parents to say, you know, maybe it is this, because that's how it was presented to us, that it could be this, it could be that, so that once the diagnosis was able to be made, we wait, you know, there was time that we could have been doing stuff because there were signs of it, but you can't diagnose them. And I understand that the requirements, I mean, we were basically, since 3.5, we've been waiting for him to turn 7. I mean, it's just crazy.
So,
but
couple of things.
there's that whole group of kids that are falling through and they're not figuring it out until they're in 2nd, 3rd, and 4th grade. And at that point, they've already started hating themselves because they know as early as kindergarten that they're not getting what other people are getting. And a perfect example is my 7-year-old who never can articulate himself. He was 7, and he said to me, I don't get why does everybody in my classroom understand what to do? I don't get it. Like, and he knows it, so they hide it for so long. So now that it's becoming more prevalent, are there things that we can do to kind of help catch that? I know it's very specific to ADHD, but
Okay, that's okay. So first of all, way beyond my pay scale, because I'm not a developmental pediatrician and I'm not even the parent of a kid with ADHD. But first I want to just clarify, I didn't mean to suggest that ADHD is becoming more prevalent. Maybe it is, and it's not what I meant to say. I meant that that is a disability that we see significant numbers both in 504 and IEP. I didn't mean that it's becoming more prevalent across the board. Maybe it is, I have no idea. But just to your question, I think that it is a disability that a lot of parents call the center struggling with it because there is a big question mark. And you know, should I go see a specialist? And it's so expensive to go see a specialist, and it's not covered in my insurance plan. All of these things, and a lot of times, again, because I'm parent center outreach, right? I'm not a medical provider. I'm not a psychiatrist. I'm not any of those things. But as a parent, I always tell people that you have to make your decisions. There's special ed and there's parenting, right? And parenting is much broader, right? So do I necessarily need to delve further in my child's medical diagnosis to navigate special ed? No. But I probably want to because I'm a mom and that's my kid and I want to know what's going on and what I should be doing. So it's sort of, you know, yes, it all overlaps. But the thing is that when you're talking about 504 plans or IEPs, the conversation is essentially limited to how are we supporting this child in navigating school. As parents, we're concerned with a hell of a lot more than just school. We're concerned about life, we're concerned about social issues, we're concerned about what the heck is this kid gonna do when I'm gone, right? There's a lot more than just school, right? So I'm not sure if I'm answering the question, but I feel like, and especially when we're dealing with little kids who, you know, how many people have told us, you know, oh, he's just a boy, you know, and
I was ripped to shreds.
Right, and I have to say, as the parent of 3 neurotypical boys, and I put it in quotes because I don't know. You know, I love my boys to the ends of the earth, and if they ever see this video as an adult, I apologize, but they all have quirky stuff about them. You know, they have quirky stuff about them, and they have, like, unusual things that I have to do to support them through their day. And, you know, interesting for them, they have this sister with a very glaring developmental disability. They don't really see her as any more needy than they are. They really don't. They know she doesn't do the schoolwork that everyone does, and they know that she really can't be by herself, right? But in the course of our family functioning and the way we operate, because you know what? My 9-year-old has real anxiety stuff going on. And my 11-year-old is bald because he has alopecia, and he thinks that's really not fair, right? And my 7-year-old, my 8-year-old, I don't know what he has. He doesn't really display anything. But my point is that they're growing up in our little world of 6 of us, and, you know, right, so I think that my advice to you, if you were calling the parent center, so everyone don't listen because we're having a private conversation, it's being videotaped, is that don't stop pursuing that medical path, you know? And if you have financial means to go pursue that medical path and find out, I mean, I have yet, going to confession here, I have yet to have my daughter assessed by a developmental pediatrician. I'm happy with her development. I am. I'm happy with her progress. I probably should. I probably will at some point, although I don't know if she falls under peds anymore. How 18, right? You know, but it's something that we all do what we do, and we all look back with all of our kids and second guess, and should I have done this, and should I have done that? So again, I'm going on, and I'm not answering your question. I wouldn't stop delving. I wouldn't stop digging. I don't know what they're doing at the state level. I don't know what the AMA is doing or the American Board of Pediatrics. I don't really know the answers to that.
You know, now being in it, I talk to a lot of parents who, you know, we're 2nd grade, so this is when it started. People are starting. Teachers are saying, "Oh, your kid's kind of not sitting still, or you know, isn't focusing and not doing homework," and you start noticing it. And I think that it does take time for parents to digest this, especially if they're totally foreign to the whole concept of, you know, any sort of challenge. So I guess, you know, my point is that it just seems like we're getting there when things have already started to kind of come apart for these kids, whether it be emotionally, you know, and again, I know it's run by state. I'm just trying to, you know, for my own, figuring out for myself, how do we figure out these, like, I knew we knew since he was 3.5, but some parents don't. I have ADHD, so that's how I know, but I was diagnosed as an adult. So I knew what signs to look when I started to see my son, behaving certain way. We thought it was this way, then, it could have been auditory, but again, you can't tell at such a young age what is going on. But I do think that because we were parents that were aware of this, we pushed and pushed and pushed, all through and kept getting, and again, you cannot diagnose this child. Like, every doctor said it, this is the rule, this is what it is. But he spent, we were fighting for him because I didn't want him to start to get to the point where he was struggling. Because once that happens, you can't just put a Band-Aid on it. You really crack the core, and then it becomes even a bigger situation to handle. So because I think, again, we were very in tune. There are so many parents that I talked to who were like, well, the teacher said that, he or she may be ADHD, but there's, no way, because there's a stigmatism with it, but then they wait, and then all of a sudden they're at the end of elementary, and this kid is like,
Just one second. The other thing I'll say though, and this is really with respect to special ed and educational supports, is that whether the student has ADHD or XYZ or ABC or whatever he has, the school district and the teaching team or the CSE or the Title IV
stepped up and
is going to address the need. It doesn't really matter why,
Totally.
right?
That's right.
So autism, ADHD, Down syndrome, a lot of the disabilities that school districts see a lot of share issues and share obstacles, right? So I think as parents, while we're figuring it out and going through the maze and wherever we are on that journey, maybe we can't swallow the pill if my kid has a disability. But at least let's try to give him what he needs and support what he needs. And maybe it's not ADHD, whatever it is. So again, there's that two-tracked, I'm going to do what I need to do to support my kid as a student. Maybe I'm not ready to grapple with what the diagnosis is. But I feel like we can support our kids as students, whether you put a label on them or not. Does that make sense? What were you going to say, Lucy?
I was going to say 3 things. One is
One.
there's 375 students with IEPs in the school district. There's another 230-ish with 504s. Of the IEPs, round numbers, around 100 have ADHD or executive functioning issues. Of the 230 504s, a big percentage, I don't know exactly what it is because it's not broken out, also. So your point is so relevant because there's so many parents that, if working together, could share information like that, best practices, and every year you're going to find a different thing. We have a fairly active group that's a subcommittee of our special ed community,
I wrote it down.
right? And they share ideas. So, your child in 2nd grade, well, there's a whole bunch of different issues you're going to need to know in middle school, and then there's a whole bunch of different ones you're going to need to.
Right.
And you can either reinvent the wheel and do trial and error on your own, or you can ask other parents what worked for them or didn't work. And again, every kid's different, every family's different, but at least you have like some data. And that's the biggest piece of advice I could lay out. Get involved in one of the parent groups because it really helps you. And it's not just like a PTA committee where you make like refreshments. I mean, it really helps you, and it also helps the school district.
Yes.
Last year,
And the other parents.
Last year we had 3, at the high school we had 3 parent ed sessions on ADHD, executive functioning skills, in like learning for the high school. 3 of them, right? Plus, and they are videotaped. That was really for high school level, but are there topics that could be appropriate for the elementary school? Absolutely.
And
You guys have to
we did
like
other ones throughout the district as
you
well.
have to design them and work with other parents, but like it really is
I like that.
powerful. The district listens. The step question for you, Stephanie, your slide that says, what is section 504? I'm sorry, who is eligible? I'm sorry, that one. We've had some questions about who is eligible because it's very loosey-goosey about
It's 504.
requirements, right? So where it says things like substantially, nobody knows what that means. And also things like having a record, substantially regarded as having an impairment. Can you address that a little bit? Because if you have a student with a learning issue or ADHD, how does that manifest itself in such a way that it's substantial?
So Can I address that? Yes and no.
Yeah,
Is 504. If we were talking about eligibility for special education, so that eligibility checklist I gave you actually came from, I think I brought it with me. No, it's not a regulation. There's a document online, and I don't even know what it's called actually, because it comes up table of contents. But if you go onto the state website and you search eligibility, there is this packet, you can look at it if you want, and it's essentially quality indicators for school districts in running their CSE and determining eligibility. And within this document, and chime in if it's not accurate or if it's changed at all, there are specific percentages discrepancy between functioning level and IQ. Specific definitions of what is a learning disability that is going to qualify.
for IEP.
Correct.
Okay.
I do not believe there is such a rigid rule for 504. Okay, again, a little bit outside of my realm. I'm not a special ed attorney or an advocate or anything like that. But I think that with 504, and again, having practiced in another area of law for 20 plus years, the law is very case by case sometimes. Yes, there are things that are specific, but a lot of times when you read case decisions or when you talk about education, it's commissioner decisions. Well, in this case, we have this, right? So it's not, and that's why in law you see a lot of words like substantially, and it's something that as a parent, is it substantially impeding my child's learning? Well, I don't know that I could give it to you in numbers and data, but as the mom, I'm going to tell you why it's substantial, right? And as the teacher, you may tell us why it's substantial. And if it's not substantial, we might all be able to agree on that. So it's really, the difference really is that 504 families really don't have that structure of the regulations underneath them. So I'm not answering the question because I can't really, but my suggestion to families would be, number one, talk to the people in your district who run 504 and ask them to explain it to you or show you what they're relying on. Okay? If you don't get sufficient information for yourself there, jump online. Reach out to the state.
Yeah.
The one thing I can say about state education, and I'm not a teacher, is that there's a wealth of information on their website and a wealth of contacts.
If anybody's interested in being on the subcommittee for 504, you can let me or Liza know, because we're going to start a subgroup on that, so people can get some expertise and understand it.
Yeah.
Can you share your, I don't want to be on the committee,
No.
but I do. And not that I don't want to, I don't have time. But I'm really, how do you, when you said you had 3 sessions last year,
Yeah.
how do you, what's the distribution? How do I?
They're in the Greeley, well, those were in the Greeley PTA email.
Okay.
Weekly
What about
email.
for the junior highs?
It was probably on the district calendar.
district calendar.
And Liza would have sent it out in her newsletter as well.
If you want to give me your email, Connie Whitehouse is in charge of the ADH committee, and I can
Okay,
email
I'll
There's
do
a
her.
that.
Facebook page.
Yeah.
But if you give me your email address, I'll make sure that you get the newsletter. And in the newsletter, there's those
Okay,
events.
that's fine. Great,
and
why don't
the
we do that?
The Facebook address and all that
Perfect,
stuff.
thank you.
And can I just say, when they talk about being on a committee, it's very different than being on a regular PTA committee.
No,
Yeah.
I don't mean, I
Yeah.
traveled 3 or 4
Right.
weeks.
Yeah, no, I'm just saying sometimes
I got in at 3 o'clock in the morning
Yeah.
from California last night,
Yeah.
I just really.
Thank you for joining us.
It's just more of an informational sort of thing a lot of the time.
And
There's no
Yeah, no,
Yeah.
it's great, I'll definitely do it.
So, I'm going to hang out for a little bit after if anybody has any questions, but if you could fill out the evaluations that are in the back of your packet, that would be great. And thank you for coming. I feel like I should say goodbye to people in computer land.
Thank you so much, Stephanie. Yay.
Thank you all for coming. Oh, wait, hold on. How could I forget? Next Wednesday night, WIHD and the Community Support Network is having a parent housing forum.
Yeah.
So I don't know how many of you this is relevant to, but Dr. Leader, who is from the Office of People with Developmental Disabilities, is going to be doing a Q&A on certified residential opportunities for our young people transitioning into adult life and looking for living options. So that's Wednesday night at WIHD, and I gave you a flyer in your packet.
Thank you.